Danielle. I'm Danielle of Danielle's Vertical Horizons. I'm on here today because I just had surgery on the 22nd of July and I wanted to share some information because I had a hard time finding an abundance of resources on what to expect when you're having surgery in a global health pandemic. So I'm hoping that somebody out there who's anticipating a surgery date in the coming weeks, hopefully weeks and months, not like years, that needs a little bit of information on what to expect can just find this quickly and is able to understand, what to expect, the protocols in place, what to bring if anything, and what hospitals are doing. So I'm going to jump into it. So again, I had my surgery on the 22nd of July and mine was laparoscopic. I don't think that matters, but it required a negative COVID test within 72 hours of the surgery window. So I went up on Tuesday the 21st at like 6 a.m. to get my COVID test. They would have preferred me on the Monday the 20th, but I was still working that day, and everyone knows what a difficult thing it is to close out and wrap up before you're out for a few weeks. So I was like, I need all the time I can get. So I pushed it to Tuesday. So they rushed the COVID test and I had a negative outcome, which is a positive, and therefore I was cleared for surgery. So in order to enter the hospital on the morning of the 22nd, my hospital required that everybody is scanned for temperature. So in order to track this, they have these little green dots and everybody has them on. You'll see, I don't know how your hospital will do it, but you'll see a commonality between everyone, and it just it does give you some sort of relief to know that at least everyone's been screened. It's not a perfect system because you can be asymptomatic and there's definitely flaws here, but at least somebody's checking. Also at the front, they give you surgical masks. So I know, and I don't know if this is universal, but I have a very industrial 4-layer mask with the filter, and I'm really careful about all things COVID, but a lot of people have bandanas and things like that. So it does give me a little bit more just overall calming feelings to know that everyone has a surgical mask so that they're blocking more particulates than a common bandana or one of those self-made masks would. So everyone has their surgical mask on. And then you were wheeled up to intake, and in intake they ask you all the questions that you need to be asked. They ask you questions like, have you been exposed to anybody with COVID in the last 14 days? Have you traveled to any of these regions? Really commonplace questions. They ask you this a few times just to make sure that I think your answers are consistently the right ones. But again, it does give you a little bit of confidence in them that they're trying to screen as best as they can. At my specific hospital, we don't have an emergency room because it's a private hospital, so they don't have the typical bustle that other public hospitals have right now dealing with COVID patients and intake. So again, that was really calming, and I appreciated that. They do have a COVID floor, but because they're private, they don't have to take anybody that comes in off the street saying I'm sick. So, which is a huge flaw of our entire healthcare system, but that's another video. So honestly, there weren't a lot of COVID patients. The COVID teams, the doctors and nurses, have their own elevators, their own cafeteria, their own parking garage. They are completely sequestered. And so again, that was a confidence booster, just because you never want, something as easy as an elevator button being pushed to be the reason that, you're infected. And so I live with my 87-year-old grandmother right now because I'm remote for work. And so I figured I would save some money and do everything. But because of that, I'm really super careful of any of the germs I'm exposed to. So that was a really great piece for me that, everyone in the COVID unit has their own stuff. They're in their own little world and they're away from you. So those are the really big things prior to surgery. So again, we had our negative COVID test. We have, masks, temperature checks, questionnaires. And then as far as surgeries being pushed for COVID, I think as we see spikes in different regions, surgeries are definitely being pushed, in Florida right now, things that they would deem elective. So if you have something that could be done at a later date and it's not, imperative to your health as a person, they're most likely going to push it if they see a crazy spike like they are seeing in Florida. I was in Los Angeles, so I definitely was concerned that it was going to be pushed, but I know it was a private hospital at the same time, so I was also like pretty confident that my date would go as planned, and it did. So I'm feeling relieved about that now on the other side. So we covered it all. Now, as we get into the pre-op, post-op phase, so you have your mask on the whole time. Again, trying to limit the spread. As you're wheeled off, you have all your doctors around you. They're all masked. Everyone is really trying to keep everything as sanitary as possible. So it's really not a perfect system, but it's what we've got right now, and I felt good about it. And then moving forward, I woke up from anesthesia, like had a mask on, was totally feeling great about surgery. I mean, it was definitely like major surgery, so I feel it, but at the same time, like I felt like really confident in the team's protocols and just what you saw around you, and it was a good feeling knowing that everyone was taking it very seriously. So then just diving into a few odds and ends, I would recommend you bring like some sort of antibacterial with you, just because as you get surgery, you're not going to be your strongest self, or you're hooked up to an IV, or you're doing this or that. And so you're not going to be able to wash your hands just because you want to and you feel like it's time. So this I had in my little hospital bag. I actually had a bag within a bag that I brought like in my bed with me, just because I had like my AirPods and things like that in there. And so I had my hand sanitizer that I would just use after I like shook hands with anybody, touched anybody was in my room, just to try and again limit the spread. And then I don't have them with me right now, they're in my car, but basically I have like the travel size Clorox wipes that I would just wipe down my bed as well, just as people, you know, come and push fluids and do this and do that. You want to be as careful as possible. And then finally, my cleaning staff was really good. You actually got to see them thoroughly clean your room and really get into everything and really, you know, touch the keyboards that the nurses are using, really go above and beyond. And it really felt like, you know, the best case scenario. I am personally going to get tested again on Tuesday, so it will have been like 6 days since I was in the hospital, just to, again, I like live with my 87-year-old grandmother, and I want to make sure that you know, there's absolutely no chance of me having it. And so to take a precaution, in the meantime, I've been like sequestered in my own little room here. So this is like a shared office. It's part music studio, part like my work office, and now it's part everything I need. It has like Gatorade and stuff in my fridge here and a little shelf of food and things like that. So I am just quarantining myself just because I've been around more people than I have been in the last 6 months. And other than that, I feel really confident. I have no symptoms. I feel, you know, honestly better than I ever thought I would coming out of surgery. And I'm really excited to kind of get on with this next chapter. Tomorrow is my COVID test, so looking forward to getting that result so I can reintegrate into a little society within my house. And yeah, so I hope this has been helpful. I realize that I'm just kind of rambling because it's a strange topic to have to talk about, but yeah, I had surgery during the COVID-19 health pandemic, and I just felt like the need to tell everybody my story and let everyone know if this is your case, or if you have something that you really need to schedule and are putting it off, you know, I would schedule it. You know, it's not a normal situation. You're in surgery, so no matter what, it's not just a normal day. But I felt like it was the best case scenario for the hand that we had been dealt, and I'm excited that we were able to, my surgery was able to move forward as scheduled. Everything went really well. I'm in recovery now, and I'm honestly feeling fine. So that was my experience, and I hope this helps you and at least alleviate some of those stressors, because I was definitely stressed going into it. And you have a great surgery yourself, or a friend or family member can as well. So thanks, guys.